Tell me your gut health story. I really want to know, what did your first 1,000 days look like, including in utero? What has stress and trauma throughout your life looked like? I had a patient yesterday who was so frustrated because she and her husband both switched their diets at the same time. And she said, here I am gaining weight, and now I've developed a new autoimmune condition, and my husband's lost weight, his blood pressure is going down, he's running up the mountains as we're hiking together. And she was just really distraught. And so we had to have that honest reflection. And, she did openly and honestly share she's had lots of abuse in her life and lots of trauma in her life, and she hasn't quite worked through it fully at this point, and she is in her 60s. So again, the nervous system is going to dictate what's going on in the gut. Then that gut dictates what's going on in the metabolism and the metabolic system, and so on and so forth. So stress and trauma is so important to really understand and speak to and process if you haven't processed and worked through it, because coping skills are great, but healing is even greater. So if you haven't healed through some of the things that you've been going through, then it's hard to heal with each meal if you're not feeling with each meal. You want to ask yourself, what has medication history looked like? Have I had food poisoning? I had hormonal imbalance? What's my family history look like? What is my genetic predisposition? Because we do know it plays a small part, where if you have the genes, they can turn on and off depending on what else is going on with your gut and with your environment. So you really do want to understand what happened, what's happening now. So we encourage people to keep a food, mood, and poop journal, because again, it's not just the food, it's what mood you're in, it's how your bowels are moving and flowing. So we want to consider that as well. And you want to seek a knowledgeable and compassionate care team. There's nothing worse than visiting a healthcare practitioner and then being like, I don't care about what you're saying and what you're feeling. This test and this paper says you're fine. So you're fine. Get out of my face. Our 7 minutes is up, right? No one wants to hear that after they've been suffering. So really reach out to someone who's knowledgeable, who's curious, and who's compassionate as well, because you don't want then to accumulate healthcare trauma on top of other things you've already gone through. And then again, you want to make sure that your healthcare team is really thoroughly looking into everything they can, turning over every stone possible. So checking different things like your hormones, nutrient status, inflammation. What's your liver? What are all those accessory organs doing? Do you have exocrine pancreatic insufficiency? Did you lose your gallbladder? What's going on there? What's going on with your endocrine system? How's your blood sugar? How's your cholesterol? What are your nerves doing? So really making sure that you have the appropriate blood tests, breath tests, if you need scopes, anything that's going to be helpful. And as a practitioner, I have the ability to order a lot of these, especially functional tests, but I always want to ask myself, is that going to change the treatment plan? Do I feel like this is going to change the outcome? You always want to be wary of a practitioner who says, in order for you to start working for me, and with me rather, you need to have this urine test and this blood test, and you need to shell out $2,000 before I can even talk to you. That person is not seeking to treat you. They are looking only at this paper, and you want to find someone who's going to treat a person, not a paper. So again, you want to ask your care team, why do you want these things? What are these things going to tell me? But really, again, if you trust your care team, you have a reputable care team, then hopefully they're not over ordering things for you, not under ordering things for you and dismissing you. You also really want to try to lean in and understand food triggers or any other types of triggers. I so commonly hear people who disassociate from their bodies because it's just such an uncomfortable place to live. So they have a hard time identifying, what does my stool look like when it comes out? Did stress impact me? What am I eating maybe that's causing me some discomfort? So it's really important to be able to reconnect with your body. If you need to do some emotional healing or nervous system healing, then that's so important to do in order for you to just listen to your body. Because if it's screaming, but you have earmuffs on, it's hard for us to understand that together as a team. And then again, you want to be open to whoever needs to be on your team. So I seldom or ever work alone. One, because I can't and I don't want to. I don't have the ability to know everything that these other amazing healthcare practitioners know. So that's where I think people become frustrated with their doctors, because they expect them to be a doctor, a dietitian, a pelvic floor therapist, a chiropractor, and they're just not. So really understand the scope and the breadth of work of that person that you're working with.